Good afternoon, everyone. I'm joined today by the Lieutenant Governor, Senate President Spilka, by Representative and Chair John Law, Representative Decker, Representative Schwartz. We also have with us Secretary of Health and Human Services Kiami Mahania, Secretary of A&F Matt Gorkowitz, and our Executive Director of the Massachusetts Health Connector, Audrey Morse-Gastair. We're here today because there's been a lot of discussion about health subsidies and the subsidies for health insurance that in effect help people pay for their health insurance here and around the country. That all happened under the Affordable Care Act, and as you know, that's gone away. President Trump and Republicans in Congress did not take action. They did not take action to extend these health care subsidies. As a result, millions of people around the country, including folks in Massachusetts, saw those subsidies go away, and as a result, we're facing and are facing significant increases in their health insurance premiums, their costs as a result. We've heard here in Massachusetts, people seeing double and triple digit increases in their health care costs. We know that in Massachusetts, between this and what happened this summer with the Big Beautiful Bill, over 300,000 people in Massachusetts are affected. Some of them have already received notice that their health care insurance is going to go up by as much as $25,000 this year. People cannot afford this. And I've been really clear, people in Massachusetts, people across the country cannot afford this. They cannot afford actions which result in even higher costs for health care. And so I want to tell you what we are doing here in Massachusetts. I continue to call on President Trump and Republicans in Congress to act. There's a vote today. They could take action today to extend these health care subsidies for people. But we can't wait for Washington to act. So as governor, in the meantime, I want to do everything that we can to make sure that people can continue to have access to health care, have access to their health insurance. Years ago, the legislature set up something called the Commonwealth Care Trust Fund. It's a fund that's there to help people who are in the Connector Care program pay for their health insurance. It's been operating for several years, and as a result has helped many more people around this state have health care coverage. So here's what we're going to do. We're going to use this trust fund money to provide more financial support. Where the federal government has taken those subsidies away, the state, through the trust fund, will provide additional funds to cover those subsidies so that people here in Massachusetts can continue to receive health insurance for the rest of the year. There are approximately 270,000 Massachusetts residents who will be helped, who will be impacted by this move. That includes a number of small business owners, individuals, seniors, families, all of whom get their coverage through the Connector Care program. Massachusetts, we expect to be providing an additional $250 million in help through the trust fund to help these people continue with their care. So if you are one of these 270,000 people, you will continue to see your health care insurance covered, helped by those subsidies. The state will be covering that, not the federal government. Again, we call on the federal government to act and to provide those funds so that people across this country can continue to access coverage. But we're taking steps where we can. Now, it's not going to help everybody because there are still people in the Connector Care program, an estimated 25,000, who aren't going to be able to qualify for this. There are other people around the state whose premiums we know are going to continue to go up, particularly because of what happened through Congress's action this summer and President Trump signing into law that legislation. But in Massachusetts, like as always, we're working to make healthcare more affordable. We lead as a state in among all states in helping people to have access to healthcare and healthcare insurance coverage. And Massachusetts today is doing more than any other state in the country when it comes to this issue. But we do need Donald Trump and Congress to act to stop these healthcare spikes and to work to lower costs. You know, as a team, all of us, we're focused on how do we make sure people have access to health care and health care that they can afford. And that's why we're taking this action today. to make sure that these credits continue through the form of coverage by the state, and of course call on Washington to do its job and take action. And as I say, there's a vote today, and I hope that the right measures are taken. At this point, I want to bring forward Director Gasteyer of the Healthcare Connector.
Thank you so much, Governor. Good afternoon. Thank you so much, Governor Healey. It is an honor to be here again with the governor, who continues to exhibit the strong leadership we need to stay at the forefront of healthcare affordability through our marketplace. As everyone knows, because of congressional inaction, 2026 marketplace coverage began without enhanced ACA premium tax credits that have been used to help make health insurance more affordable for tens of millions of Americans, including hundreds of thousands here in Massachusetts over the last 5 years. The loss of enhanced tax credits is a serious setback to the financing of health coverage for individuals and families across the state. And our response to that setback as the Commonwealth and as the Health Connector is critically important to all of those people who rely on us for their health care and their financial security. For nearly 20 years, Massachusetts has led the way in expanding and maintaining near universal health coverage. And as Governor Healey said, we will continue to do everything we can to remain a national leader in this endeavor. At the heart of this work is the Health Connector's Connector Care program, which taps into not just federal tax credits, but also state funding to help make healthcare more affordable to more than 270,000 people through lower premiums and copays, the absence of deductibles, and access to no-cost services and prescriptions for chronic diseases. Connector Care means not just having health insurance with premiums you can afford, but meaningful access to care and services without cost barriers. My team and I hear from Connector Care enrollees every single day that this program is how they sleep at night, that it allows them to manage chronic conditions and stay healthy, that it allowed them to get a screening that caught a cancer diagnosis early, that it allowed them the security to start their own business, that it means they can afford rent and groceries, that it has saved them from medical debt, that in many cases it has saved their lives. Since the Health Connector's inception back in 2006, Massachusetts has valued that kind of protection by including significant state investment in subsidized coverage, first in the Commonwealth Care Program and later alongside Affordable Care Act subsidies through our flagship Connector Care program. When the federal government enhanced ACA tax credits back in 2021, they modeled the level of affordability it wanted to provide to the nation after what we had done in Massachusetts because it had worked so well. Now that the federal government has pulled that enhanced support away, we are grateful and relieved to, with an increased state expenditure in 2026, continue to provide the most affordable coverage possible through Connector Care, which is by far the most generous, effective, and successful program of its type in the nation, with the results to prove it. It is why we have the most number of residents insured than any other state. The state's fiscal commitment to Connector Care means that the majority of individuals in Massachusetts whose tax credit amounts have been slashed by federal inaction will see either no premium increases or significantly lower premium increases than they'd see were it not for the Connector Care program. And for people not yet enrolled, it's important they know that the doors to Connector Care in 2026 remain open, as our open enrollment period continues through January 23rd. So if you need help, don't hesitate to reach out. Our customer service center is available at 877-MA-ENROLL, and we have trained knowledgeable, helpful navigators all across the state to assist people in 50 locations. You can find the help you need in your community by visiting mahealthconnector.org and clicking on the Help Center tab at the top of the page. We continue to urge Congress to take action and to reinstate the expired tax credits, and quickly, particularly because there are still tens of thousands of people here in Massachusetts outside of the reach of Connector Care who've been depending on these tax credits. If Congress passes an extension, we are ready to turn on a dime and get that support into the hands of those who need it as rapidly as possible. But in the meantime, Governor Healey, legislative leaders, the Health Connector, and the Commonwealth remain dedicated to delivering the most affordable coverage possible to everyone in Massachusetts. Thank you, Governor Healey, for your leadership and commitment to keeping Massachusetts out front as a leader on health care. And with that, it is now my honor to introduce Senate President Karen Spilka.
Thank you. Thank you, Governor Healey, Lieutenant Governor Driscoll, and thank you, Audrey, for all of the speakers that are here today. I am very proud to stand here today and represent the Mass State Senate with Governor Healey, members of her administration, and our colleagues in the House of Representatives. And I do want to acknowledge the Senate co-chair of the Healthcare Finance Committee, Senator Friedman, who has been a champion for the Senate, and with proudness that we are all standing here with one voice. Wouldn't that be great if Washington could do that? We are standing today on the side of Massachusetts residents, and we are standing on the side of healthcare affordability and access. It is clear that the Trump administration is more concerned with starting illegal wars, enriching his billionaire cronies, and pursuing powers for its own sake than addressing the very real kitchen table issues that we all face, especially the rising costs of healthcare. Massachusetts, we know, has long been a leader in expanding access to healthcare for all residents for decades, and everyone standing here believes that the role of government is to help make life more manageable and more affordable for all of our residents. The Trump administration and congressional Republicans may have forgotten that they work for us, but we in Massachusetts have continued to maintain our strong commitment to our residents. While we will never be able to make up for all of the cuts and irresponsible actions from the federal government, we promise to continue to work together and collaborate together to do what we can to protect our residents and defend our Massachusetts values. I'm proud of the partnership that this announcement represents, and I'm proud to say, Massachusetts, we have your back. And now I'd like to introduce an important partner, the House Chair of the Joint Committee on Healthcare Financing, Representative John Lawn.
Thank you, Senate President Spilker. And on behalf of my colleagues on the House and Speaker Mariano, I would like to thank you, Governor Healey and Lieutenant Governor Driscoll, for your partnership in prioritizing this funding that we have here today. I want to be very clear about why today matters. Because of federal inaction, hundreds of thousands of Massachusetts residents were facing dramatic increases in their health insurance premiums. Not because they did anything wrong, but because Washington failed to do their job. This is unacceptable. In Massachusetts, when the federal government is retreating, we do not retreat with it. Under the governor's leadership and with the legislative support, we are stepping up with the strongest response in the nation. This $250 million increase in the Connected Care is not symbolic. It is real relief for real families who depend on affordable coverage to stay healthy and financially stable. As House Chair of the Joint Committee on Healthcare Financing, I'll say this plainly. When coverage becomes unaffordable, people don't stop needing care. Costs will shift, outcomes will worsen, and everyone pays more in the long term. This investment keeps people covered, it keeps premiums in check, and it keeps our healthcare system stable at a moment when federal policy is doing the opposite. Massachusetts has always led by action. We don't just talk about affordability, we protect it. We don't just acknowledge harm, we step in to prevent it. I am proud to support the governor's plan, and I'm proud to be part of a Commonwealth that continues to put patients first, no matter what is happening in Washington.